You know the expression, it takes a village to raise a child. Well, through a pandemic, it has taken a village of individuals to keep our world going. And those who have gone in to work in person day after day after day, thank you for doing that. And some occupations have had changes where things were very different at the start and then got back to a little bit more of a normal run, and then there have been spurts here and there where they've been different or more challenging again. One constant through all of this has been healthcare workers, where they really haven't had the break, because even if we've seen waves of COVID-19 subside, there has been catch-up to do. And so we're now looking from March of 2020, essentially, and they may even be able to say, no, it was a little earlier than that, March of 2020 through until now, December of 2021. That is 21 months. That is 21 months where things have been intense and they just haven't changed. To get some perspective on that, Dr. Rick Tytus is the Associate Clinical Professor in the Department of Family Medicine at McMaster University, and he's the co-founder of Banty, and he joins us now. Dr. Tytus, thanks so much for your time.
Thanks, Mike. It's a pleasure to be on the radio.
First off, let's just get some background on Banty. What is Banty?
Well, Banty is a virtual platform. As you pointed out, we're practicing medicine differently now. We're segueing, we're sort of employing technology, and it's a virtual medicine platform where it integrates seamlessly into the practice, where you can connect, see your doctor, see your nurse, see your dietitian, and it's easy to use.
Okay. So that's been one of the tools that maybe has assisted in some of the challenges that have happened, but you've been able to look at just the entire landscape of healthcare. What do we need to understand about what it's been like over these 21 months for healthcare workers?
Well, the OMA came out with a survey, and a survey was completed in March 2021. It was published in August 2021. And in that survey, they found that 34.6% of physicians were suffering from burnout. So that survey was done in March of 2021. So we just recently had a continuing medical education program. Actually, a week ago, we had over 100 physicians. And we asked that same question, and at that time, 71.9% of the physicians said, hey, we're suffering from burnout. This is becoming overwhelming. So, I thought it doubled in 9 months.
Yeah, going from 35% up to 71.8%. Now, how would burnout be described?
Well, burnout is it's what it causes depression. It can cause even suicidal thoughts. It negatively impacts physicians' productivity. So it's a real issue that we have to address. And there's a couple suggestions that the OMA has made in their paper in August 2021.
And what would those suggestions be?
Yeah. Well, some of the suggestions were, first of all, is we're in a new era. We're in a new era of technology, and we have to embrace it. So some of these things are like using virtual medicine and seamless integration of digital health tools. But also when it comes to the patient side, I think it's more it's now the ability of remote patient management technologies, such as continuous glucose monitoring, such as using home blood pressure with Wi-Fi. So there's such O2 sats at home. So there's tools and technologies that we have to utilize.
And that's something that I'm sure those things have been there, but has the pandemic almost in amongst all of the things it has done to the healthcare system, has it forced kind of the usage of those to a greater extent, or at least the acceptance of those, because there really was no other way?
Yeah, for sure. So now with these home technologies, with these remote patient management technologies, which we had before, but we never put into play. So because of the pandemic, we're now practicing differently. So with these, for example, with the continuous glucose monitoring, your blood sugar is in the cloud now. So your physician, when you see your physician, you can see your physician virtually on a virtual platform, and the physician can see your blood sugars, what it was 3 a.m, and what was it during the day. So now, employing these new technologies, you don't have to come to the office. You don't have to stand in line for 3 hours waiting for a lab test. So I think the way we're going to be practicing in the future is totally different than the past, and it's all thanks to the pandemic.
Dr. Rick Tytus is the Associate Clinical Professor in the Department of Family Medicine at McMaster University. There are very few times you get an opportunity to say it's all thanks to the pandemic, but there may be some things coming out of that assist us. Now, when you look at the burnout factor, could it be possible eventually to ask those physicians and those medical professionals if they were to implement some of the remote opportunities that you have, or remote techniques that you have? Could that alleviate some of that burnout, or does that say, you were taking care of 2,000 patients before, now you'll be able to take care of 3,500?
Well, Mike, let's not go there. I think we're going to have a lot of catch-up. So it's not only dealing with the pandemic issues, but it's the untoward issues of the pandemic. So people not coming in for preventative medicine, catching up on the mammograms, on the bone density, on the colorectal screening. So, I think our plates will be full when the pandemic ends and for years afterwards, just catching up.
And that's something else that must make physicians and healthcare professionals look ahead and say, yeah, when it's over, it's not really over. Any message that you think needs to be spread around that's going to alleviate that? Because that just seems to add to those feelings of burnout and all of the negatives that can come with them.
Yeah, so I think the overarching message is there's two. One is, please get your booster shot. And the other is, it's time to come back to your family doctor. It's time to get tested. It's time to do your preventative medicine.
Well, those are things that hopefully we have happening at a great rate so that we can ensure that we're all as healthy as possible going forward. At the same time, let's hope we can see some breaks set in for some of these healthcare professionals who have been working pretty solid, because Dr. Tytus, that's been the thing. There've been the odd day off here and there, but nothing like it would normally be, right?
Well, I have not had a day off. Our clinic at Steel City Medical, we have not had a day off. We've been there 100% of the time. Mind you, it's changed slightly, so we might be doing 30 to 40% virtual, but we've always been at the clinic. We've always been there for our patients, as most physicians have.
Well, keep up the great work. I know that you speak for an awful lot of healthcare professionals in the way that you've had to handle things and the way you've been handling things. Dr. Tytus, hopefully there's a little downtime at least over the next little while, and hopefully we can get ourselves out of this and into better times. We appreciate your time today. Thank you.